Hello and welcome. Sorry for being a bit late today. Yesterday we have read up to the year troubles of Sora. Okay. Yesterday we have read up to the year troubles of Sora. Today we will start from next regarding face. Okay, you will see that the shape of Soric face is inverted pyramid. What is inverted pyramid? Means pointed chin. This pointed chin. Okay, if you are having what it is called physiognomic features. Okay, if you read the human faces, you will read that human faces may be of a square shaped, maybe of oval shaped, maybe having pointed chin. So these are should be in your observation as a homeopathic physician. Try to observe the body structure of your patient, or generally whoever you are seeing. Try to observe the body posture, body structure. Okay, anthropologically, that which type of faces, how many type of faces are there. You can relocate that in your region. These type of faces are very common. Say in your region, you will find that oval faces are very common. You will find that asymmetrical faces you are seeing more and more. So this indicate the predominant miasm in the population. Okay, these are the you can say the modifying influences of the place of abode. You will see that those who are living in the hilly regions are having a particular cut of face. Those who are living in near the sea are having a particular cut of face. So these are the influences of the place of abode, what we have read already in aphorism number 81 to some extent. And to some extent you will be able to judge the predominant miasm in your population. In a population you are practicing it, if you happen to practice in a small town, it will be very easier for you. uh, so these Soric faces are of inverted pyramid. And what is inverted pyramid? Inverted pyramid, you can easily relocate that it is having a pointed chin. Okay, have you seen any such face, triangular faces? Any such face you have seen? No. Try to observe from now onward. Yes or no?
Yes. Don't
Oh, you have seen.
remember.
Do not
I
remember.
think
Okay,
I
try to.
have.
Okay, try to observe from now and onwards what kind of face the person you are meeting are having. It may be oval faces, it may be square shaped, this jawline, and then chin. Chin is like that. Okay, this is square shaped, and in some particular cases you will see the pointed chin. Jawline is there and chin is pointed. So it is triangular faces or inverted pyramid. Basically, this is the phases of Psora. We used to have fun during our during our organon classes in our undergraduate studies. Okay, these kind of phases, where to find these kind of phases? But in clinical practice, we are getting such phases actually. Okay, and it is helping a lot. Okay, so read this. Now go on, read this. This was a
The shape,
physiognomic feature of different miasm I was discussing. If you are getting an asymmetrical faces, our face are generally a symmetrical one. If you are getting asymmetrical faces, be sure that it is predominantly a syphilitic miasm. Okay, next, read.
the shape of the sodic face is that of an inverted pyramid, but the face and head do not perspire as does the syphilitic condition. Perspiration is characteristic also of the tubercular diathesis, but this is because of the syphilitic admixture with the sodic. The lips are red, often red to bluish, parched and dry. The usual fibrous face in the sodic patient is red and hot and shining. There are the characteristic dry itching pimples and simple acne. The skin is naturally dry with an unwashed appearance. Rushes of blood to the face or burning of hands or feet are sodic, as are hot flushes at the climacteric.
Okay, what you are seeing here is dryness is the hallmark of Psora. Dryness, and you will see itching pimples and simple acne, acne rosacea. Acne rosacea is not of psoric. It will be very difficult to cure such acne. Okay, what is acne rosacea? Is a particular kind of peculiar kind of acne covering the nose and around the nose area. Pustular type of acne. These are acnes are very difficult, but acnes in the psoric constitution are easier to treat. That is why you are finding in your daily life that some people are well responding to your medicine and some people are not. Those who are not responding are not a kind of simple acne. They are carrying a complicated acne. Okay. Similarly, you are seeing perspiration is characteristics also of the tubercular. Psora is dry, so no perspiration, but tubercular due to admixture of syphilis. Okay, so tubercular diathesis, we have already told that it is the one of the complex disease formed by mixture of Psora and syphilis. Clear? This Psora and syphilis, J. Allen is calling it tubercular miasm or tubercular, better to call it and remember it for all your academic purpose as diathesis, not miasm. Though J. Allen have called it at some places miasm, but you should not utter this word miasm for tubercular diathesis until and unless you have passed your post-graduation examination. Okay, for all the practical purpose, you can say it tubercular miasm, but not for your academic purpose. Okay, this is tubercular diathesis. Only 3 miasms are there, and this tubercular diathesis is admixture of Psora and syphilis according to Roberts, but according to J.H. Allen, this can be Psora and psychosis. Okay. So this is a complex disease. We have already told that Hahnemann have already told that Psora and syphilis. At many places, Hahnemann is not talking about Psora and psychosis that much as he is talking about Psora and syphilis, admixture of Psora and syphilis. Okay. At many places, he is talking about Psora and syphilis. Like open aphorism number 232. Aphorism number 232. 1, 2, 3, 4, 5, 6. See, 1, 2, 3. Third line. Third line. Complicated with a syphilitic miasm. Complicated with syphilitic miasm. Alternating disease. Complicating with syphilitic miasm. Psora and syphilitic. Psora alone, but sometimes complicated with syphilitic miasm. Okay. Like aphorism number this 40. Aphorism number 40. 1, 2, 3, 4, 5, 6th line. Thus a syphilitic patient may become psoric and vice versa. Are two diseases dissimilar to each other. They cannot remove, cannot cure one another. At first, venereal symptoms are kept in abeyance and suspended. When the psoric eruption begins to appear in course of time, they, however, as a syphilis is at least as strong as Psora. The two joins and form a complex disease. Aphorism number 40. So Hahnemann is talking about more Psora and syphilis. So he was also finding the complex disease of Psora and syphilis. What J.H. Allen is calling it diathesis. Tubercular diathesis. Okay, not tubercular miasm. What is tubercular diathesis? It is a complex disease formed due to admixture of Psora and syphilis. Okay. According to J.H. Allen, it can be Psora and syphilis and Psora and psychosis. And according to Roberts, it is Psora and syphilis. Clear? So we have two nosodes from tuberculosis. One is tuberculum, one is bacillinum. Some authority are telling that tuberculinum are more suitable for Psora and syphilis, and bacillinum are more suitable for Psora and psychosis. Okay? Remember this. It will help you in clinic. Next.
In the nose also, we find the oversensitiveness to odors. Unusual odors awaken him from sleep. He cannot sleep where there are strong odors. Perfumes make him feel ill and faint. There are painful boils or pimples on the septum, but no malignant manifestations.
Okay. Again, oversensitiveness to odors. Every senses are oversensitive. Eyes. You remember that Psora eyes was photophobic. You remember that Psora was oversensitive to noise. So Psora is oversensitive to smell also. Okay. Next.
Lupus of the nose is a manifestation of the combined stigmata and closely allied to tuberculosis.
Okay. This is lupus is tuberculosis. Next.
Sores about the mouth are soric manifestations. There is swelling and burning
What
about the
is
lips
swords?
rather
What is
than
swords?
fissures.
What is swords?
Pardon.
Abscess like uh, uh, means whitish. Sometimes you will see the whitish at the corner of mouth. Okay. Ulceration at the corner of mouth you can see, no, or abscess like at the corners of mouth. Okay. Next.
There is swelling and burning about the lips rather than fissures. There is thrush and stomatitis in the mouth. The soric patient has many taste perversions. There is a bad taste in the mouth, or it may be sweet, bitter, or sour. There is a regurgitation of the taste of foods. These patients are very sensitive to taste. While all the miasms or stigmata have many perversions of taste, Psora is the only one who manifests the symptoms of burnt taste.
Okay. Underline this. Oversensitive to taste. Oversensitive to taste. And this one, Psora is the only one which manifests the symptom of burnt taste. Do you remember the taste of burnt taste in which medicine it is? Burnt taste in mouth. And if something is burnt in mouth, baptisia, Borix metriometica, you will see that burnt taste in mouth is a symptom of baptisia written in Borix metriometica. So burnt taste, whenever patient is complaining of burnt taste, think of Psora, because it is the only miasm according to Robert which is producing such kind of taste perversion. Okay, nowadays during pandemic you will get lots of taste perversion and totally, sometimes totally loss of taste. Okay, loss of smell, loss of taste, total loss of smell, loss of taste is of psychotic nature. Okay, and in pandemic you are seeing this total loss of taste, total loss of smell after COVID. This was a common complication of this pandemic. Next.
Psora is always hungry. This miasm has desires and longings for many and various things. They are hungry even with the stomach full. They are never satisfied even while eating. They crave sweets, acids, sour things. In fevers, they crave indigestible things. They long for travel, yet they are weak and debilitated. They long for things the system is wanting. They long for certain things, yet after gestation, they loathe the things they have craved. Before bilious attacks, they crave sweets, but the attack is not caused by the sweets they consume. Rather, the craving is a forerunner of the attack, a, prod- a prodromal symptom.
Okay. Always hungry, underline, even with the full stomach. Name some medicine with canine hunger. Name some medicine with canine hunger.
Abrotenum ravenous hunger
What is actually canine hunger?
wants to eat मतलब खा रहा है फिर भी खाना है और पेट
Yes.
भर नहीं रहा है ऐसे।
Canine. Which animal we are telling canine? Canine is dog. Hungry like a dog.
हाँ,
Okay. In lycopodium, you will see canine hunger. Canine hunger. Okay. In many medicine, actually, there is canine hunger. Hungry like a dog. Even with the stomach full, they need to eat more and more. So it is Psora. And one, tell me one disease, which symptom it is, of which the symptom is. One disease. Increased appetite. पॉलीडिप्सिया, पॉलीफेजिया, पॉलीयूरिया, डायबिटीज। डॉक्टर साहब बहुत भूख लग रही है, अगर पेशेंट मिडिल एजेड है तो
yes,
आस्क फॉर डायबिटीज, आस्क फॉर अ शुगर टेस्ट, ब्लड शुगर टेस्ट। अगर पेशेंट यंग एजेड है तो आस्क फॉर शुगर अलोंग विथ मोस्ट प्रोबेबली थायराइड। ओके, हाइपरथायरॉइडिज्म, पेशेंट का वेट घट रहा है, डायबिटीज भी हो सकता है, थायराइड भी हो सकता है। ओके, हाइपरथायरॉइडिज्म, hungry even after a full meal. See, lycopodium, same sentence is there. Next, they are hungry even with a full stomach. Underline, crave sweet, acid, sour things. Underline, sulfur का craving हम लोग को मालूम है, sweets, okay, और sour and acid things. In fevers, they crave indigestible thing. Underline this. They long for travel, yet they are weak and debilitated. They long for things the system is wanting. Underline this. Have you seen the patient taking chalks, eating walls, eating clays? System is
yes,
wanting. When the system is in want of calcium, in want of vitamin D, in want of silicea or some minerals, these symptoms develop. Okay, indigestible things and crave for things the system is wanting. Okay, sometime in pregnancy, whatever test changes, the desire changes in pregnancy indicates the true basis of the disease, both for the mother and both for the mother and child. Okay, that is why sometime during intrauterine history we ask the patient that what was your desire during pregnancy. Okay, many times it happens that you are not getting desire of the patient as of now, but you will get means patient is confused about her desire, but if you ask during the pregnancy and she can tell you precisely that Dr. Saab, I was looting with egg and I was desiring this particular thing. Okay, that is the true desire for the mother, and sometimes this desire is also applicable for the child. Okay, and you can prescribe over that. So during pregnancy the changes in desire are important. During pregnancy they long for peculiar things, yet after gestation they lose the things they have craved. After gestation, during pregnancy those peculiar things longed for, and after you will see that those patients who have aversion to fish during pregnancy, they will desire for fish. And what is this? This is the bipolar attitude of a desire. We have discussed this bipolar things in previous classes. Okay, so pregnancy is an important period in a female's life. That is why Hahnemann have given lots of importance to this. Aphorism number 93, footnote. Aphorism number 93, footnote. 94, footnote. In chronic diseases of females, 94, footnote. It is especially necessary to pay attention to pregnancy. Okay. sterility, sexual desire, accouchments, okay, the gestation, miscarriage, suckling, lactation. These are the periods of in the female life which should be given importance, and the best period for treatment of a female during for anti-miasmatic uh, disease is during pregnancy. Aphorism number 286 or 84. 284, sixth edition. 284, sixth edition. Footnote. Okay. So where Hahnemann is talking about protecting posterity and advance, which is very helpful for the mother and for the child. Next paragraph.
There is a weak, gone feeling in the stomach in the middle of the forenoon. Hunger at night also is a prominent symptom. These patients lack the power of assimilation, which is undoubtedly
सल्फर का क्या है? Open sulfur in Allen's keynote. Let me bring my Allen's keynote. Open sulfur in Allen's keynote. And see, hungry, weak, empty, gone,
about 11
feeling in
a.m.
the stomach, about 11 a.m.
About yes,
Yes.
yes.
So sulfur is the king of anti-Psora. We can compare most of the symptoms of Psora with sulfur, except those chilly, extreme chilly. Psora is extreme hot and sulfur is extreme chilly. But you will get sometimes sulfur as hot. Seldom you will get, and this is because that bipolar modality, bipolar symptom, bipolarity. We have discussed during our discussion of secondary action, primary action, and all that. But that are very few cases, exceptions. Next.
These patients lack the power of assimilation, which is undoubtedly the cause of the continual craving, and is closely related to the characteristic gnawing in the stomach with sensations of heat and cold. There is a repugnance to boiled foods. They crave fried and highly seasoned foods, meats, and greasy foods, but these do not suit. Meats stimulate the psoriatic patient and arouse the underlying condition to activity. In fevers, they have an aversion to sweets and crave acids. The sense of
Underline this.
fullness, gas, bloating, etc. are markedly psoriatic traits, and they are accompanied by heartburn and water breath. Most of the aggravations of psora occur after eating.
Underline this. Most of the aggravations of Psora occur after eating. The sense of fullness, gas, bloating, these are the symptoms which you won't find any specific remedy for your patient, and your patient will disturb you again and again with this. Doctor Saab, gas, yahan jata hai, gas wahan. Particularly in Bengal, we are getting patients of particular means hysterical type of fullness of abdomen. The gas in the brain, gas in the hatu, gas in the knee, gas in the everywhere, gas is gas. All these are, be sure, are psoriatic symptoms, superficial psoriatic symptoms, and can easily be treated with your anti-psoriatic remedies. Repugnance to boiled food, don't want to eat vegetables, don't want to eat boiled food, highly seasoned food, but they can't assimilate them. They are aggravating factor. Okay, remember Naxvamika, what is happening with after overeating, after a spicy meal, after seasoned food, he is having disturbed gastric symptom. Okay, next.
The cravings and longings are basic phenomena of great therapeutic value. A comparison of the desire of the stigmatic influences is of much help in selecting the remedy. Psora desires hot food, syphilis prefers cold food, psychosis wants the food either hot or cold. Psora desires
Underline this,
meat.
never forget this. Underline this, never forget this line. Psora hot, syphilis cold, and psychosis either. hot or cold? This will be asked to you again and again in your MCQ examination, in your job examination, in your Viva, in your clinic. Basically, it is very helpful in your clinic. You can easily differentiate the predominant miasm with this. Underline this. Psora desire hot food, syphilis prefers cold food, and psychosis wants the food either hot or cold.
Psora desires meats, but the combination of Psora and syphilis in the tubercular diathesis has an aversion to meats.
Tubercular diathesis has an aversion to meat. Underline this. And Psora desires meat. Underline this. But in tubercular diathesis, when Psora is prominent, you will get the desire for smoked meat. Okay? Desire for smoked meat. Can you tell me a medicine for this? Calcarea Phos. Okay, go to Calcarea Phos and you will see desire for smoked meat. What is smoked meat? Kebab. Okay, kebab like items. These are desire for tubercular diathesis when the Psora is dominant. When the syphilis is dominant, it will have aversion to it. So syphilis has aversion and psychosis has aversion from it and intolerance. More intolerance in psychosis than syphilis. Syphilis will not eat at all, no meat, and psychosis have the aversion plus intolerance. Even if he is taking meat, he will have intolerance to that. Okay, next. And Psora desires meat. Psoric patient, predominantly psoric patient, you will get desire for meat. You will get in traditional vegetarian families, one child is outside eating lots of meat outside without the knowledge of the parent. This is predominantly psoric child who is satisfying his craving of meat. Okay, next.
With the bloating of the psoric patient, he cannot endure the slightest touch on the abdomen. He fears even the slightest contact.
Okay, again this is what? Oversensitiveness to touch. Oversensitiveness to touch, is it not?
Yes.
Oversensitiveness. Everywhere oversensitiveness you are finding oversensitiveness touch. All the five senses. What are all the five senses? Eyes, nose, ears, taste and touch. Okay, all the five senses are oversensitive. Next.
While pure Psora does not produce any structural changes, Psora does produce functional changes. These are manifest in the chest condition by the anemic manifestations that have their effect on the duty of furnishing oxygen for the red blood cells. The emotional reaction of Psora hampers the natural functions to such an extent that the functions are disturbed and the oxygen circulation feels the lack of vitalizing influence.
You will get psoric patient that are sudden become hysterical out of emotion. Okay, sudden कोई news सुना बेहोश हो गया. This is not structural. This is functional and hysterical. And Psora is predominantly. Don't be afraid of such patient getting faint again and again due to some emotion, fear and grief. Okay, these are psoric manifestation, hysterical manifestation. No structural changes are there. If there is a structural changes and you are getting convulsion in the brain, there is a space occupying lesion and you are getting convulsion. These convulsions are not of psoric nature but of syphilitic nature. But if there is no nothing is there, just an emotional disturbance, history of emotional disturbance you are getting, after that this fainting or convulsion have started, be sure that the Psora is predominantly present. Though difficult to cure, but it is not going to kill your patient. But in syphilis, if it is there, some pathological lesion in the brain is there, is very dangerous for your patient. Next.
The coughs of Psora are dry, teasing, spasmodic, and annoying. The expectoration is usually mucus, scanty, tasteless. The salty and sweetish taste of the expectoration are dependable indications of the combined psoric and syphilitic trends.
Dependable means on which you can depend. Name a medicine which has this salty or sweetish taste of expectoration. Go to sternum in Allen's keynote. Sternum. See the line cuff. Deep, hollow, shattering, strangling, concussive. Next, expectoration. Profuse like the white of an egg, sweetish, salty. In bracket, you will get kali iode and sepia. Kali iode is a syphilitic medicine. Kali iode, anti-syphilitic medicine. Sepia, due to its, though it is a predominantly psychotic, but due to presence of this syphilitic miasm, it is having this sweetish or saltish taste. Expectoration of Psora is tasteless, bland. But if you are getting this salty or sweetish taste, think of combination of syphilis. Sternum is one of the medicine indicated for this. Next.
In the heart, there are functional disturbances with violent rushes of blood to the chest and a sensation of weakness, goneness, or fullness about the heart. The sensation as of a band is psoric. This miasm or stigma manifests its reflex relationship of gastric or uterine irritations by marked palpitations or sensations as of hammering about the heart. With the heart symptoms, there is always anxiety and fear on the part of the patient. The psoric The psoric patient always fears that he will die from heart trouble, but the psoric patient is the chronic who lives long and produces income for the physician, for he is the victim of so many unpleasant sensations that he requires much attention, and his habit of fixing his attention upon one or more organs as being the cause of his discomfort demands constant attendance from the physician. He does have many uncomfortable sensations, such as sharp cutting neuralgic pains about the heart. These patients think they are about to die and want to lie down and keep quiet. But there is no danger. It is the psychotic and syphilitic patients who die, and then suddenly and without warning. Historic heart
Underline this.
conditions are where
Underline this. Psychotic and syphilitic heart patient who die and then suddenly without warning. You have heard about cases in your relative or neighbors or in distant relative that रात में सोया सुबह में नहीं उठा. What was there? A silent heart attack. Okay, that indicates a syphilitic and psychotic trend. You will get in the family history of your patient that my father died of suddenly. Okay, sudden death in one of the family member is one of the indication for syphilitic miasm in the family. Sudden death. If you are getting death at old age, it indicates a in the relatives or in the family members, immediate family members, if you are getting the longevity of life, it indicates predominancy of the Psora in the family. If you are getting sudden death in the family, it indicates the predominancy of syphilis or psychosis, mainly syphilis. A sudden death at a young age, okay, रेस्टोरेंट में खाना खाते खाते मर गया, अचानक से कफ किया मर गया. Okay, this is a sudden heart attack, a sudden death in a close family member or close relative, indicative of a syphilitic tent the your patient is carrying. Okay, a sudden death. Always remember to ask your patient at what age so and so relative have died. Okay, मेरे माँ बाबा मर गए, बोलेगा पेशेंट के उनका डेथ हो गया, तो आप पूछिएगा at what age. You have to ask at what age they have died. If they are telling at 90 years, 80 years, no need to worry. It is carrying, the patient is carrying predominantly psoric miasm. If they are telling he died at the age of 40 or 34, this indicates a syphilitic trend in the family history. Okay, so now again in the heart symptom of Psora, so many unpleasant sensation, but nothing to worry about. You won't get any abnormality in ECG, any abnormality in echo, and the patient is constantly telling that I have this kind of pain, that kind of pain, band-like sensation. This band-like sensation you are getting in cactus and many other medicine. Okay, so this is because of the psoric patient have lots of subjective symptoms, subjective sensation, and nothing to worry about. And Robert himself is telling that these are the patient who will bring lots of income. Give the patient your indicated medicine and a lot of placebo, and you will get income from these kind of patients. These kind of patients need assurance, okay, not the medicine. But if they insist on medicine, give your placebo along with your indicated medicine. Next.
Disorganic heart conditions are very much influenced by strong emotions, joy, grief, fear, and so on. These conditions are aggravated eating and drinking. There are palpitations and conditions are sorry. There are palpitations and ejections of large amounts of gas. Sometimes the pulsations of the heart will shake the whole body. The psoriatic patient is always conscious of his heart conditions, and it is he who is constantly taking his own pulse.
Okay, underline this. The pulsation of heart will shake the whole body, conscious of this heart attack. But this pulsation of heart shaking the whole body is also an organic, maybe present in organic disease. Okay, like aortic regurgitation has Musset sign of this constant nodding of the head. Okay, so maybe present in some organic disease. But this pulsation is like shaking the whole body. This is all also a sensation of the Psora. Next.
Soda alone produces more marked anasarca and dropsical conditions than psychosis. The psychotic patient succumbs before the dropsical conditions becomes marked, but the union of these two stigmata produces these conditions in a marked degree.
What is anasarca?
Generalized drops,
Swelling,
edema,
edema. Okay,
swelling.
generalized edema. Okay, in you will see that edema, most common cause of edema is
What's up?
most common cause of edema. This generalized anasarca, most common cause. Protein deficiency. Okay, न्यूट्रिशनल खाने को नहीं मिल रहा है एंड द पेशेंट इज सफरिंग फ्रॉम प्रोटीन डेफिशिएंसी. Okay, nutritional protein deficiency, and this protein deficiency, even if the patient is taking, they have told that soda is cannot assimilating, so maybe there is protein deficiency. Albumin, जब albumin blood में नहीं रहेगा तो what will happen? Osmotic pressure change होगा and the fluid will start to collect in the interstitial spaces. Okay, so this is one of the commonest cause of anasarca or edema, protein deficiency. Next, the edema may be due to heart failure, may be due to CRS, kidney failure. So think of those later on, but first check whether the albumin level is correct or not. Okay, this albumin level may be disturbed in this nephrotic syndrome or nephritis, where excess of the albumin is being lost. Okay, ultimately it is the protein deficiency which is producing edema. Okay, so the Psora will produce these kind of edema because in psychosis, Robert is telling that those patients succumbs before the edema get well marked. Next.
The abdomen feels full after eating. There is much distension, aggravation in the morning. The muscles are flabby and all abdominal pains are ameliorated by heat.
Okay, this is common amelioration and aggravation of Psora. Amelioration by heat, aggravation in morning.
The diarrheas of soda are often induced by overeating. The patient is
Underline
always
this.
hungry and eats.
Underline this. Overeating. Always hungry. Overeating होगा ही होगा.
The patient is always hungry and eats beyond his capacity and upsets his digestive powers. This overeating often produces a colic and watery diarrhea, usually in the morning. These diarrheas fit the symptomatology of such remedies as aloe, podophyllum, and sulfur, among others.
Okay, mostly aloe, mostly with this kind of diarrhea. Aloe is a, what we are telling, aloe is an antisoric remedy like sulfur. It has a venous predominance, venous congestion, many things common in aloe and sulfur, so that it is complementary to sulfur. See, sulfur, see sulfur relation, complementary aloe sorinum, and see aloe relation.
Like
Like
sulfur
sulfur
in
in
many
many
chronic
chronic
diseases.
diseases, with abdominal plethora and congestion of water circulation, develop suppressed eruption. Okay, so there is a one common thing between aloe and sulfur. Both are predominantly a antisoric remedy. And one more medicine you can add to that, podophyllum. But these kind of diarrhea usually go after overeating. Diarrhea after overeating, colicky with colicky pain, usually go with nux and aloe. Why I am saying this? It is easier. Why it is easier for us to locate the medicine? Because of our knowledge of miasm. Next,
In the tubercular diathesis, there is also the morning aggravation of the diarrhea, and the tubercular condition shows its sodic parentage by the aggravation from cold.
next.
Psora has a spasmodic, offensive, and painless diarrhea, which usually ameliorates the suffering.
Diarrhea
But it is
ameliorates
not
the suffering. Spasmodic suffering means colic is ameliorated by diarrhea.
a persistent diarrhea. It comes on from emissions or from preparations for an unusual event. After taking cold, aggravated by cold, ameliorated by hot drinks or heat in general.
Next. This is all about diarrhea of Psora. If you asked, been asked in your examination, write diarrhea of Psora, you will write these points. And common point you can remember: aggravation in morning, aggravation by overeating, aggravation on emotion, any sudden emotion. What is this? Preparation for unusual event. What is this? It is stimulating the emotion. Okay, taking cold, amelioration by heat, amelioration after discharge. Okay, these are the common point you can write for diarrhea of Psora. Next, constipation of Psora.
There is a stubborn, marked, persistent constipation with small, hard, difficult stools and no desire for stool. Or there may be alternation of the constipation and diarrhea. With the constipation, there are frequently accompanying troubles in other parts of the organism or seemingly unrelated symptoms which are actually concomitants.
Okay, बोलेगा पेशेंट आके बोलेगा डॉक्टर साहब जब भी कॉन्स्टिपेशन होता है आई विल गेट एक्नी whenever I am constipated I will get this and that symptom. Okay, unhappy when he is constipated, which medicine? Dissatisfied with himself whenever he is constipated, which medicine? Fourth line, aloe socotina. Remember, whenever in a medicine, if with a physical symptom, you are getting a mental concomitant, it is very important. Whenever with a mental symptom, you are getting a physical concomitant, it is also very important. Concomitants are important. The more away from the disease the symptom is, the more it is important. Okay, so here in aloe you are seeing dissatisfied and angry about himself or his complaint, especially when constipated. Okay. So this is a mental concomitant with a physical. So I was telling about that psoric patient, whenever they are constipation, they are suffering from constipation, they will have another seemingly unrelated symptom. That constipation से acne हो रहा है, constipation से हमको नींद नहीं आ रहा है, constipation से हमको सीने में दर्द हो रहा है, constipation ऐसा लग रहा है मेरा यहाँ पे आ गया. This is all of the psoric condition. Okay, and alternating of constipation and diarrhea, the famous symptom for sulfur, famous symptom for aloe, and it is one of the symptom for Psora. Next.
Psora is not only the mother of all diseases, but it is the sodic element which gives the valuable concomitant symptoms and furnishes the modalities and sensations which are a true expression of their suffering. The sodic
Underline
patients
this.
suffer considerably.
All the mother, not only mother of all chronic, give the valuable concomitant sensation modality. It is the sodic element in the disease which is giving all this.
The psoric patients suffer considerably, probably much more than in the other stigmata, and with less apparent cause.
Okay. Next, suffer much, but there is no danger of pathology. They will live longer.
In children afflicted with this underlying condition, we find retention of the urine whenever the body gets chilled, and this condition arises in old people also. An opposite indication of the sodic stigma is the involuntary urination when sneezing, coughing, or laughing. There is a smarting and burning on urination, but not from pathological causes.
Okay, in children, this is one of the important symptoms for Psora. Whenever they are chilled, gets chilled, and right in the margin, whenever they are afraid of sudden fright, you will get retention of urine in old children, especially towards villages when there is no proper lighting at night. Child gets frightened all of a sudden. Sometime small infant, sometime you will get this symptom in infant when the child gets frightened and apparently with no cause. The mother is complaining that the child has not passed water for last 12 hours or 24 hours, and by seeing the face you can analyze that this child has got a fright. Okay, and in that condition this resulted in retention of urine, and that can be easily overcome by giving your medicine aconite. Okay, many cases I have treated have this symptom, retention of urine after fright, both in children and both in the old people. Old people are being called as second fright. So some symptoms, some medicines are there which are very important in extremes of age, like veratrum useful for extremes of age, both for children and at the old age. So they are getting somewhat similar symptoms. Here also gets chilled. Whenever they get chilled, they have retention of urine. Same thing happening in a old people. Okay, an opposite condition of that, involuntary urination. Involuntary urination, if this is not due to valvular affection, if it is not due to any pathological condition, it is Psora. Okay, next. Okay, we will stop here and start from next day onward, next paragraph, from next paragraph onward. Any question you are having, so that we can answer it. Any question you are having?
No, sir.
Okay, I hope you people are understanding these classes and actually enjoying reading these uh, reading about these diseases and miasms. If you have any question, those who are seeing recordings, if you have any question, can ask me in the group or can ask me personally in WhatsApp. Okay, thank you.